Your periods are irregular. Your weight is increasing. Hair fall is getting worse. Mood swings are becoming normal. And still, every report says everything is fine. But deep inside the body, something is already burning. And no, this is not just an ovarian problem anymore. Today, doctors and metabolic experts across the world are discussing in a new term, PMOS, and not just PCOS, but Polyendocrine Metabolic Ovarian Syndrome. And trust me, this single name changes the entire way we understand women's health. Namaskar, I am Dr. Hitesh Chaudhari, Ayurvedic consultant and metabolic disorders expert. On this channel, Ayurlife Circle, we don't just talk about diseases, we decode the root cause behind them. In my previous video on insulin resistance, I explained how modern lifestyle silently damages hormones, metabolisms, liver, brain, fertility, almost every system in the body. And today you will understand something very important. Many women think they have a period problem, but actually they have a metabolic problem. For years, we used the term PCOS, that is Polycystic Ovarian Syndrome. Sounds simple, right? Problem in ovaries, cyst in ovaries, treatment for ovaries. But medicine is evolving. And now researchers are realizing something shocking. Many women with PCOS don't even have cysts. Yes, you heard that correctly. And on the other hand, many girls already have weight gain, insulin resistance, acne, hair fall, facial hair growth, mood swings, fatty liver, infertility issues, even before cysts appear. So the question became, was PCOS ever only an ovarian disease, or were ovaries simply becoming the victim of a deeper metabolic disturbance? And this is where the term PMOS started becoming popular in the metabolic medicines and functional endocrinology discussions as well. So polyendocrine metabolic ovarian syndrome, meaning this condition is affecting multiple hormonal systems altogether. Insulin, ovaries, adrenal hormones, fat metabolism, liver brain chemistry, inflammation, pathways, everything is interconnected. And honestly, this makes much more sense clinically. Because if the root is metabolic dysfunction, then only treating period is like silencing a fire alarm while the house is still burning. Now understand this carefully. The biggest villain in most PMOS cases is insulin resistance. And insulin resistance is not just a sugar problem. It is a hormonal chaos creator. The moment cells stop responding properly to insulin, the body produces more insulin. That excess insulin starts stimulating ovaries. Then ovaries start producing excess androgens. Ovulation gets disturbed. Fat storage increases in the body, that gives rise to inflammation, and craving increases, energy crashes happen. Periods become irregular, and slowly the body enters metabolic dysfunctions. And this is why many women with PCOS also suffer from belly fat, fatty liver, thyroid dysfunctions, high triglycerides, constant fatigue, sleep problems, anxiety, brain fog, even depression, because hormones never work in isolations. The body is not a WhatsApp group with a separate departments. Everything talks to everything. And the most dangerous part, many women normalize these symptoms for years. Hair fall तो normal है, periods irregular है तो stress की वजह से होगा, weight loss नहीं हो रहा because metabolism slow हो गया है. No. Sometimes these are early metabolic warning signals. The body whispers before it screams. Research now shows that a very high percentage of women with PCOS already have insulin resistance. Many also have vitamin D deficiency, high fasting insulin, gut microbiome imbalance, chronic inflammation, sleep disturbances, and even increased future risk of type 2 diabetes, hypertension, infertility, miscarriages, and cardiovascular diseases. So, what symptoms should women never ignore? Irregular periods, weight gain, especially around the abdomen, acne after teenage, facial hair growth, hair thinning, dark pigmentations around the neck or underarms, sugar cravings, sleepiness after the meals, and difficulty losing weight despite efforts, mood swings, anxiety, infertility. So these are not random symptoms. This is metabolism sending notifications. And please understand one important thing. Ultrasound alone is not enough. Many women keep changing doctors because reports look normal. If you truly want to assess PMOS properly, you must evaluate metabolism along with hormones. Important tests includes fasting insulin, HbA1c, fasting blood sugar, lipid profile, liver function test, and vitamin D, B12, ferritin, hormonal profiles like LH, FSH, testosterone, DHEA, prolactin, AMH, thyroid profile, because if insulin resistance remains hidden, symptoms keep returning. Now let us understand this from Ayurveda. Ayurveda never looked at disease as isolated organs. Ayurveda always looked at the body as interconnected systems. And when we analyze PMOS through Ayurveda, we see clear involvement of Agnimandya, Kapha aggravations, Meda Dushti, Artava Dushti, and Strotorodha, meaning impaired metabolism, disturbed fat metabolism, blocked body channels, hormonal imbalance, and inflammatory dysfunctions. And Ayurveda explains beautifully, Rogaha sarveapi mandagnau, meaning almost all diseases begin with disturbed Agni. And honestly, if you observe PMOS carefully, that is exactly what happens. Poor digestions, poor metabolism, poor cellular energy handling. Then another important principle comes, Strotorodhat vata prakopaha. When body channels get obstructed, normal physiology gets disturbed. Today, modern medicine calls inflammation, insulin resistance, metabolic dysfunctions. But Ayurveda described the same concept thousands of years ago through Agni and Strotasa. And now comes the questions every woman asks me. Doctor, which Ayurvedic herbs actually helps in PMOS? But understand this carefully. In Ayurveda, herbs are not used to simply suppress symptoms. They are selected according to dosha, dhatu, agni, strotasa, and the root pathology behind the disease. Meaning, the goal is to improve metabolisms, reduce kapha meda dushti, and clear strotorodha, support Artava, and restore hormonal rhythm naturally. One of the most important herb here is Ashoka. Ashoka is considered one of the best herbs for women's reproductive health. It mainly acts on Artava Srotas. In many PMOS women, there is pelvic congestion, irregular bleeding, Pitta Kapha imbalance, and disturbed endometrial physiology. So Ashoka helps in regulating menstrual rhythm, reducing excessive bleeding tendencies, and calming inflammation and supporting healthy Artava formation. And that is why Ashoka has been classically used in many gynecological disorders for centuries. Second important herb, Shatavari. Now many people think Shatavari is only a female tonic, but actually Shatavari works as a rasayana. It nourishes rasadhatu and supports hormonal stability. Women living in chronic stress, poor sleep, emotional exhaustion, overworking, crash dieting often develop Vata Pitta aggravation along with hormonal imbalance, and Shatavari helps bring that system back into balance. In simple words, it helps the body shift from survival mode into healing mode. Third important herb is Guduchi. And honestly, Guduchi is one of the most important herbs in metabolic dysfunction, because PMOS is not only a reproductive disorder, there is a hidden inflammation, ama accumulations, disturbed liver metabolism, and impaired Agni inside the body. So Guduchi works as Agnidipaka, Amapachaka and Rasayana, meaning it improves metabolic fire. It helps clear inflammatory toxins and it supports liver functions and improves overall metabolic resilience. But remember one important thing, no herb can outwork a destructive lifestyle. You cannot sleep at 2 a.m., eat ultra-processed food daily, live in a chronic stress, avoid movement and expect hormones to heal magically. Ayurveda never believed in shortcut healing. Ayurveda believes in restoring rhythms because when rhythm returns, hormone starts listening again. So can PMOS improve? Absolutely yes. But treatment should not be symptom suppression only. You cannot heal hormones while continuing the same inflammatory lifestyle. A true integrated approach works best. Modern medicine helps in improving insulin sensitivity, supporting ovulations, managing metabolic risk factors. And at the same time, Ayurveda helps in correcting your Agni, reducing Kapha Meda Dushti, improving liver and gut function, and reducing inflammations, which helps in supporting menstrual rhythm, stress reductions, sleep corrections, and personalized healing according to Prakriti. And yes, exercise matters, but not punishment style exercises. Strength training, walking after meals, circadian rhythm corrections, protein optimizations, stress management, sleep repair, because hormones are deeply connected with lifestyle rhythm. Now remember this line, PMOS is not your body betraying you. It is your body asking you to slow down, reset and heal. And if you truly want to understand how insulin resistance, fatty liver, obesity, thyroid dysfunctions, metabolism inflammation and PMOS are all connected, then join my free webinar. The registration link is given in the descriptions below. And if this video changed the way you look at the women's health, please like, share and subscribe and send this video to every woman who has been told everything is normal when clearly it was not. Thank you.